Well, thank you very much, Mr. Chairman, and thank you, gentlemen, for your service. And I know Senator Shane touched on the interagency coordination, but I was at Fort Detrick on Monday at the NIH laboratory, the DHS laboratory, and the DoD laboratory, and there are many pictures of you there, Dr. Fauci. So you and deservedly so. So it's just a report from the front. But anything you might want to add about the coordination between departments? And one aspect particularly that I find intriguing is sort of identifying the problem at the earliest possible stage. You know, we know the Zika virus, mosquito-borne virus, is a current issue, but we can all sort of expect there'll be another wave of mosquito-borne viruses, and what are we doing in terms of coordination efforts between departments to try to identify the next threat as well as deal with this one?
Well, I think, Senator, you picked up on something that's quite true, is that our cooperation and collaboration with a number of agencies, particularly the Department of Defense, and the interactions that we've had now for some time up in Frederick and in Fort Detrick, has really been very important. And I think it showed itself wonderfully during the Ebola outbreak, when we really had an extraordinary amount of interaction that I think hastened things. With regard to the surveillance, Dr. Frieden and the CDC is very much involved as part of an international security network to try and to surveil and find the outbreak before it all of a sudden gets out of hand. And that's the goal of this international security network that we have.
And Dr. Frieden.
I just would reiterate what you've said and what Dr. Fauci said. The Department of Defense played an extremely important role in the Ebola response, and we're already in conversations with them on diagnostics. We've provided them with our kits and materials, and also on mosquito control, where they have a high degree of excellence and some capacity and significant capacity in mosquito control. So they are fully integrated into the response here. And in a broader sense, the global health security agenda is our way of cross-governmental collaboration to find threats when they first emerge, stop them as quickly as possible, and prevent them wherever that's possible.
Let me follow up on that question in terms of surveillance and preemption, if you will, in terms of the state and local level. Are you coordinating with the state public health departments and other agencies for spraying mosquitoes? You mentioned how if in Response Center Alexandria, the state health departments are really the point of contact for particularly pregnant women who have concerns. Can you elaborate on your coordination with state and local?
We work very closely with state, tribal, territorial, and local health departments and mosquito control districts, which can sometimes be separate areas. In fact, one of the key components of the emergency supplemental requests is to provide funding to do better at tracking and stopping the growth of mosquito populations.
Do you anticipate that there will be widespread preemptive spraying beginning very soon when the weather changes? And how far north, essentially, will that go? Do you have an idea?
Well, as spring and summer approach, we will see an increase in mosquito populations, and we'll see areas, particularly there are two types of mosquitoes that spread this virus. One of them, Aedes aegypti, spreads it in primarily the southern states. That is the mosquito that spreads this virus more effectively. So those are the areas that are at greatest risk of having clusters or local transmission of this virus. And we've already seen some of those states scaling up their activities. We would like to have the resources to provide to them to do that as rapidly, as effectively as possible. There's a secondary mosquito vector called albopictus, or the tiger mosquito, that's much more widely distributed, and that will somewhat depend on the local populations of mosquitoes and the capacities. But we have another component of the supplemental request, which would also strengthen activities there.
Thank you very much. Thank you, Mr. Chairman.